स्लाइड्स में मैं चला रहा हूँ या
मैं चलाऊंगी।
चलो ठीक है। तो गुड मॉर्निंग एवरीवन, आई एम Dr. Shailinder Singh.
Starting our session, I'm Dr. Sadia Rafiq, and I'm privileged to moderate this webinar under the patronage of our worthy Vice Chancellor, Professor Dr. Mahmood Ayaz, and Dean of Public Health and Head of Department Community Medicine, Professor Dr. Saira Afzal. So I welcome all the participants on this webinar, and before moving forward, I would request all of our participants to kindly drop their questions in the chat box so we can address them at the end. So I would like to... Yes, sir.
Carry on. I'll just position you, carry on.
Yes. I would like to introduce our guest speaker, Dr. Shailinder Singh. He is consultant pediatric surgeon in Nottingham University Hospital, NHS Trust, Nottingham, UK. Also co-chairman of Medical Staff Committee for the Queen's Medical Centre of NUH and head of Vascular Clinical Investigate Unit at Children's Hospital, NUH. Sir, I warmly welcome you here on this platform. Yes, before going, I would request Professor Dr. Saira Afzal to kindly share her views regarding this one.
Thank you very much, Dr. Sadia. This is a wonderful opportunity to learn the lessons from a very highly expert and knowledgeable person, Dr. Shailinder Singh, and we are really glad to have him here. And through this journey, we would have the lessons how our young generation can make their mark in foreign countries like United Kingdom and USA. So very warm welcome, Dr. Shailinder Singh.
Thank you so much, ma'am, for your kind words.
Thank you very much for I come from Nottingham University Hospitals. As you can see from this slide, I don't know whether you can see. I can't. Should I start my own PowerPoint?
Yes, sir, please.
Can I go to the next slide, please?
Yes, sir.
The next slide, please. Yeah. So this is the place where I work. It's called Nottingham University Hospital. Can we go for the back slide, please? This is a hospital which has got 28 miles of corridor. So we jokingly say that you can run a marathon inside. So this is the hospital where is my base hospital, but from this hospital, I usually take a sabbatical. I go to United States of America. I work in Washington, DC for a year. Then I worked for West Virginia University as a chief of pediatric surgery, and then I come back. So it's like my base hospital. Next slide, please. This is a quote from my mom I want to share with you, and I'll read it very slowly. How happy is he born and taught, who serveth not another's will, whose armor is his honest thought, and truthfulness his utmost skill. Next slide, please. I do have a conflict of interest because you will see I'll be talking a lot about the United States of America. So I'm an overseas citizen of India, British citizen, but I am a big fan of United States of America. So my office has all these 3 flags, but I'll be talking about America. So I'm declaring my conflict of interest. Next slide, please. Next slide, please. Yeah, next slide, please. Yeah, the one with the map. Yeah. This is my journey through the country. So I started my career in India. I was there till the age of... do me a favor. Can I just connect my internet? Then it might work better. I've got internet now.
Okay, sir.
Can I? Yeah, let me do that. Because then I'll go with the flow.
Okay.
Just give me 1 minute. Declared, sorry. Okay, I'll tell you my journey. I started in India. I did my MBBS. Then I did my master's in surgery from PGH Chandigarh. Then I did my MCH, and I used to be assistant professor. And then I was 32. At that time, I left for England. I did my 4 years training. Then I went to Kuwait for 6 months as a visiting professor. Then I went to Australia for 2.5 years as a clinical fellow, and then came back to United Kingdom in Nottingham as a consultant. Now, I had done my USMLEs, and that's the message I want to convey to all the faculty, young faculty, as well as resident. Because I did them at the age of 32, and then I finished them at the age of 48, I could go to United States straight as a consultant and as a chief of department without doing a single month of residency and fellowship. That is the message I want to convey to you people loud and clear. So what did I learn from America? I haven't learned much, as I'll say, from the UK. Australia never impressed me. India, if it was good, why would I leave it? Kuwait, it doesn't come on my radar. So I'll stick my talk to 3.5 years. And I told you, being an American green card holder in extraordinary ability category, I have a bias, and I'm aware of that. The first thing, the beauty of America is whom to select. They are very, very particular. And the second is whom to develop and whom to promote. And I repeat, wherever there's a map of America, I'm talking about United States of America. Coming to selection of residents and fellows, this is a very, very robust process. 10 faculty members are involved for the selection. Each of the 10 meet each of the candidate 1:1 and for 30 minutes. And then we score the candidate. And then we discuss those candidates so that there is no group thing. Everyone has evaluated them separately and then discussed in the presence of everyone, where each and every candidate's photograph is put, and all the 10 can put their remarks. And if somebody has scored 2, he has to justify why he did that. If somebody says score 8 or 9, he has to justify. In other words, it's a very, very robust process with no bias. And then the candidates score the program. So they are scoring us. So all the 10 faculties and the whole program gets scored. And then there is a national matching. So in the end, if I'm the chief of pediatric surgery in West Virginia, I get what we are looking for, and the candidates get the program they are looking for. Okay. Coming to selection of faculty, this is a very interesting process. So when I was established consultant in United Kingdom from 2001, I got headhunted from Children's National Medical Center, Washington, D.C., where you can see Michelle Obama sitting there. And the first lady comes to this hospital every year on the Christmas, because this hospital is literally 2 miles from the White House. And it's a flagship hospital. And they didn't get the pediatric urologist nationally, so they started hunting internationally, and I got headhunted in Nottingham. That time I had only done step 1, step USMLE. I've never, ever worked in America. So I got flown to the United States of America in Washington, D.C. I was given a very busy itinerary of 3 days, which starts with morning breakfast, lunch, dinner. Basically, I am seeing 10 to 15 people a day, and it lasted 3 days. I was on my final day, and I was sitting with the chief of pediatric gastroenterology, Dr. Parvati, and she gets a phone call. And she says to that person, "Can I please call you back because I am amidst a very important interview?" And I was taken aback. I said, "Dr. Parvati, are you interviewing me? We were talking about food in South India and all those things, her pets and her hobbies." She says, "Yeah, that's interview." Then I jokingly said, "Are you trying to tell me the 4 faculty members who took me out for a dinner last night, was it an interview?" She says, "Yeah, that was interview." I said, "What about day before? There were another 4 faculty, chief of gastroenterology, chief of cardiac surgery." She says, "Yeah, that's interview." And then she showed me a paper. And all that was a A4 sheet. It says, "Do you select Dr. Singh, yes or no?" And free text. That's it. And then she told me at the end of 3 days, 40 sheets like that from 40 different people will go to the surgeon in chief and then the chief medical officer. And you will get either hired or you will be told, "Go home." But what I'm saying is that in order to hire one faculty for 1 year from the UK, they cannot take a chance. It is that robust a process. And the same happened when I went in West Virginia, and there I was selected as a chief for 2 years and 3 months. So what I'm trying to say is that having worked in UK, Australia, India, Kuwait, and visited, 50 other countries, no country in the world conducts their interview process where they assess you for 3 days. And in West Virginia, it was 2-3 days separate tours. And on the third tour, they got my wife. So she's also being interviewed in an informal way. So basically, once you do that, you can tease between behavior and personality. As Abraham Lincoln said, you can make fool of some people all the time, all the people sometime, but not all the people all time. So I have never seen this. And this is a very standard American practice. When it comes to leadership, imagine if that's the selection for the faculty, if you have to select a dean or a chief medical officer or a vice chancellor or a president of the university, do you think they will have any shortcuts? No. And same is with the chief president. If we have to select a chief president in United States, we have to have an open discussion about the 5 prospect candidates for a full half-day session, where each of those 5 people's photograph is put on the screen. Each one is discussed by all the 70 to 80. We discuss what we call SWOT analysis, their strengths, their weaknesses, opportunities, and threats which the institution have, and only then we select. In other words, it's an absolute democracy where majority is the final. However, the minority is listened, the person is debated. So when this person gets elected, he is in charge of 50 to 60 residents. We can't get that wrong. And nobody can say he is that person's stooge, because 70 to 80 faculty members discussed, decided, and rubber stamped. And then that person stays chief resident for 1 year. And that is a very powerful position. Now, if chief resident is there, chairman of the department is even more. So what do? They'll have a selection committee. So they will have a stakeholders from all the relevant faculties, head of nursing, head of domestics, chief of pediatric surgery, chief of gastroenterology, radiology, all the people, and including chief of the sweepers, because you can't get it wrong. So this committee of 12 people do a headhunting and advert, followed by a robust process of shortlisting. And if you don't get person nationally, we'll go internationally, as they went for me times 2. Then there is the interviews, 1 to 2 rounds. Again, each round 3 days. An interview means lunch, dinner, breakfast, and informal discussion. Nobody walks with a suitcase into a room with 12 people. No, that's not the American way. And then we recommend the 2 candidates to Dean, and Dean picks the one. So this way, you cannot have a psychophancy. And that is what is make America America. And why do they do that? They want to get the right people on the bus first. If you get the wrong people, you can't move very forward. And we don't want to waste resources to get the wrong people off the bus. We get them right in the beginning. Because although I can fire you in America within a year, because everyone in the faculty in West Virginia applies for their contract every year. So, it's very easy to, get people off the bus. But the other beauty I found there was that if, let's say as a chief, I hired somebody, he doesn't fit after a year, in spite of that robust interview, I will not throw him out of the bus. I will point him to the right bus. I'll pick up the phone to Missouri, Texas, and say, look, the boy is good. This is his strength. This is his weakness. Somehow he does not fit into the team. It's like a mismatch between the plant and the soil. I want you to give him another chance. So basically, you do not throw people out of the bus. You change the bus. And this is only US, not England, not Australia, nowhere in the world. The reason is that if you get the right people on the bus, you don't have problem of motivation and managing. They are intrinsically motivated. And I used to say as a chief in West Virginia that if I have to motivate and manage any junior or any staff member, I got my selection process wrong. So we talked about behavior versus personality. So basically this process of interview in United States, we are interested in your personality. Whereas in United Kingdom, India, and Australia, we are looking at the behavior. And I laugh when people say, oh, he came for the interview and I gave him the job because he answered those questions very well in those 1 hour drama. Hey guys, that is behavior. I can change your behavior by reward and punishment. I can't change your personality. I can't get it wrong. Then this is another model which is used in the selection of the residents, chairman, chief resident. It's a Warren Buffett model. I call it integrity, passion, ability model, and I'll tell that. And then there's another model called PI principle. And that is very important for young faculty or for the resident or for the medical students. So let me talk about the first principle. Warren Buffett, the richest man in the world, worth 35 billion, who stays in a 3-bedroom house and still drives an old Toyota. He says, when I am interviewing the people, I only look at first one thing in that interview, in that person, integrity. I probe it. I spend 15 to 20 minutes looking at the integrity. And if that is missing, interview stops and then I say, send the next candidate. I'm not interested in him. If the integrity boxes tick, then I look for the passion. If that is missing, out. I'm not interested. You may have integrity, but you have no passion to do your job. Out. And then the last thing I look is ability. He says, I can hire anyone with integrity and passion, but I'll have none who will have the topmost ability, but he lacks integrity and passion. I don't want those people. They are, clever idiots. I don't need them. Or clever criminals. I don't need them. So that's a very good thing, The other thing is what I call PI principle, PI, P-I-E, for leadership selection. So of course we look at the performance, but that's 1/3. If you are a good performer, we'll hire you. There we'll look at your track record, we'll look at everything. Then comes the I. This is very, very important. What is your image? Internal and external. External is, how do you look at? If I'm the chief of pediatric surgery, my tummy is half out, my shirt is half out, my shoes are not scrubbed, or I'm unruffled, out. How would I be a chairman of, 80 residents and 200 faculty if I have got no dress code? And then comes the internal image. How comfortable I am when I look myself in my mirror. In other words, how self-assured this person is. As we say, tell me what he brags and I'll tell you what he lacks. So we will look. And then the third part comes as I-E, exposure. Is this person only a surgeon or is he an MBA? Has he worked in 5 countries? Have he worked in 5 systems? If it's a CEO position, has he worked in other industries? If your exposure is that you only, you were trained in same institute, you stayed there and you want to be dean there, what exposure you had? You don't know what the California is doing, what the Japan is doing, what the Australia is doing, out. So what I'm saying is that for leadership position, it's a PI rule, 1/3 performance, 1/3 image, and 1/3 exposure. And that is where, when I went to West Virginia, I was promoted as a chief on top of the white people who are American board, American trained, and they're senior to me. Why? Because my exposure was more than them. I had worked in 5 continents. I got an MBA. I worked as a training program director. So there I stand. Again, this is something I learned. If you don't get a person, don't be in a hurry to fill the position. So they call it interim chair, interim chairman, interim CEO, interim medical director, interim chief medical officer. And that person will say interim, and they'll keep on looking till they get the right person. If they don't get it nationally, they'll hunt for you internationally. And if America knows you're a man of extraordinary or exceptional ability, you can't hide from them. Whether you're in Afghanistan, Pakistan, India, Vietnam, they will airlift you. They'll sort out your visa within 10 days. They know how to do it. but they want the best person. So there is always a debate when I did my MBA, culture versus strategy. And there's a famous quote: culture eats strategy for breakfast, lunch, and dinner. In other words, if the culture of a place is wrong, I can bring the best strategist there. He's going to fail. So culture is very, very important. And culture is top down. If your top is gone, your culture is gone. It doesn't stop from bottom up. It all trickles from top to bottom. And whether it's politics or Google or it's a medical dean, if the top man is wrong, everything is gone. And that is why they spend a lot of money, time, resources, and everything on the top position. And once the culture is set, the strategy evolves. And that is something which is a big difference between US and United States. In Oxford, where my daughter did her master's in economics and management, and then she went to Harvard to do her MBA. She says, I can go to Oxford 10 years, I can go 20 years. It's the same culture. You wear the gown. This is how we do the things. Nothing changes. But she says, when I go to Harvard, after every 3 years, things have changed. But the culture is strict. But the strategy to achieve and maintain that culture is ever changing. So like I give you a small example. When I was the chief of pediatric surgery in West Virginia, on every Wednesday morning for half a day, all the residents and fellows, they get half day off for a dedicated teaching. So I was very interested. I said, okay, I'll also go and see what they are being taught. So they had a perfused cadaver. So the cadaver where the artificial blood is running in the arteries and veins, and dead person is on the cardiopulmonary bypass. Then they'll stab the iliac artery and tell him, I want you to cross clamp the aorta, in other words, close the tap in 5 minutes. If not, you are failed. You can't go through the residency of 5 years if you can't do it in 5 minutes. So these residents in those 5 years of the residency know how to cross clamp the thoracic aorta in 5 minutes, and they learn it 40 to 50 times a year. So in other words, by the time they finish the 5-year residency, they know how to cross clamp the aorta with the half eye closed in 2 minutes for rest of their life. And I'll tell you frankly, I was 57, chief of pediatric surgery, who didn't know this. And I learned it. And I'll give you a story. One day we had a child with a bullet injury, 11 bullets, and my chief resident called me. She said, Dr. Singh, I got a child with 11 bullets. I said, Dr. Lyle, we never call them by the first name. I said, Dr. Lyle, it will take me 5 minutes. I said, what are you going to do in 5 minutes? Before I could finish my sentence, she says, sir, the tap is closed, which means thoracic aorta is clamped to the left thoracotomy. The holes are plugged. The child is on the operating table. 10 units are cross match. IC knows. Take your time, sir. The bleeding is not. I went there. We opened the abdomen, 3 holes in the iliacs. We closed them. Cross clamp of the aorta released. Job done. Now, if this girl didn't know how to cross clamp the aorta in the first 2 minutes of that person arriving after the bullet injury, even the best surgeon can't do anything. So what I'm saying is that is the level of commitment and training. And they used to teach them entire trauma. Basically, if I know how to close the tap, anything below the diaphragm, the bleeding has stopped, unless it's a venous bleed. But you plug the holes, So what I'm saying is, these things you can't talk on AI. And this model must have costed them something like $200 million to procure and to run. But they do it. Then other thing which I saw in the West Virginia was reward the right behavior of the teachers. So the trainees pick up the best teacher. So 50 residents every year vote anonymously and pick the best trainer. And that trainer is then rewarded huge reputational and monetary. Like I worked there for a year. I've never done any residency or fellowship in United States of America. And you can read it. I'm called the outstanding attending surgeon, which means not pediatric surgery. I must be the best teacher among all the surgical specialties. Pediatric surgery, adult orthopedics, adult plastic surgery, adult, transplant. And this medal is given to me at a huge ceremony by the resident where the dean sits, the faculty sits. It's attended by 500 honorable people, including the senator. But who gives me the prize? The residents. Because those are the people who have selected me. And of course, there's a monetary reward. But look what has written. Dr. Singh, thank you for having a great mentor. Amanda, which is this girl. She's my chief resident. And those of you who think that America is very Western, I'll tell you, this award was given to me. You can see it in 2017-18. I went in 22 when this girl, Dr. Parmer, I call it, became the assistant professor of trauma after 2-3 fellowships outside the university. And I went into her office and she was sitting. Of course, I'll go and sit opposite her table. She got up. She said, no, sir, you're going to sit on my chair. I can't sit in front of you like that. And I jokingly asked her, I said, Amanda, supposing I called the CEO of the hospital, would you do that? And he was very factual like American. He said, why should I do that? He never taught me. You taught me. I said, supposing I bring the chairman of the department. She says, no, Dr. Marsh had nothing to do with my teaching and training. So what I'm saying is, I am talking about 2022 America, where a white lady to a brown man with a turban is so much indebted. And I don't see that in the East. Then comes the flying hours. You know, when you compare the two pilots, you don't say I've served in the British Airways for 40 years. I don't care. I want to know, out of those 40 years, what were your flying hours? How much time you were up in the sky? Or we call it mileage. I'm not interested you work for 30 years. I want to know what is the mileage you gain in the 30 years. And that is the mileage which American resident does. In their 2 years fellowship, they work something like 4,000 hours. And I went to Boston Children's Hospital here. They have 24 faculty members in pediatric surgery. And there are only 2 fellows to train. So these people do all the groundwork which our residents in India, Australia, and UK do. And their job is Monday to Friday, 7 a.m. to 5 p.m. operating room. Job done. So imagine what sort of training they come. Then coming to West Virginia, I told you, very structured program. And the faculty holds half a day bleep for all the trainings every week. And when I say faculty, as a chief, I used to hold that bleep. So every half day, and I've never seen that anywhere in the world. And the reason is very simple. Why they do it? That's why. Because in US, the trainees are not for service provision. We have other staff who gives the service provision. I would hire as a chief nurse practitioners, physician assistants, so that my trainees as a chief don't have to do anything which doesn't go into the basket of training. I'm not interested in them providing a service. I've got other people who can do the jobs. These people can take the bloods, they can write the notes, they can write the TPN orders, they can chase the results. Why do I ask these people to do that? They will only do the things which lead to the training, period. That's it. My job for 2 years is to train the best people, and not every American thinks like that. And I have never seen American attending pediatric or general or any surgeons operating on the operating table from the right side. We all operate from the left. In other words, we teach. Every case is a teaching case. I've never seen any faculty operating. Doesn't matter whether it's cardiac surgery or whatever. The training has to do, and I have to teach. Coming to leadership model, this gentleman, which you are seeing in this slide, he's 77. He's on a $4.4 million salary. He became president of this university at the age of 37. Now he's 77. In between, he's been president of 6 Ivy League universities in the United States. So he holds a faculty dinner for each new faculty every year, like faculty of engineering, humanities, law, medicine. So when it was medicine, I was, of course, invited, and there were 150 other consultants or attendings or assistant professors or associate professors. So when he came to my table, I asked him, I said, Mr. President, I want to see you for 2 minutes. Can I know which table you are? He just smiled. Basically, the man doesn't have a table. He doesn't eat. He only meets people. You got a book called Leaders Eat Art. Last, I used to tell him, I said, I will write a book on you, sir. leaders don't eat at all on the dinners. So his job was to meet 150 people. That's called leadership. And in each department, whether I worked in Washington, D.C. or West Virginia, and I worked overall 3.5 years in both things. If you take me to the department of neurosurgery, plastic surgery, or any department and make me meet those 6 faculty for 10 minutes, I'll tell you who's the chief of the department. Because his IQ and EQ, emotional quotient, and people skill will be far above the other 5. And that is why he's on that. Not because of seniority, not because of age, not because of whom he knows, who he is. And people skill, that he cares. And that is why in US, people don't retire. This man, Professor Libicki, is a pediatric orthopedic surgeon and a very good orthopedic general surgeon. 77, he comes to the hospital at 5:30 a.m. in the morning. And I used to come, so we used to every day meet in the car park, 5:30 a.m. And he was the last man to leave the hospital at 11. And I would usually meet him at the Starbucks in the hospital there. And one day I asked him, I said, when are you going to retire? He said, why should I? So what I'm saying is that there is something else which is motivating these people, which I don't see in any other countries. In US, or sorry, UK and Australia, oh, I'm 62, I need to retire. These people don't retire. They work till 80. They work till they're dead. And then they are a family. Like I can tell you name of each and every resident in this category, and I know each and every resident where they are, because every year I get an email from them, sir, I have reached there, I become faculty, this, that. We are a family. Look, you can see how confident they are. This is a girl from Northwest Province of Pakistan. True Pathan. Look at her body posture. Look at this girl. Look at them. They are very, very committed and they are very family. This is again a picture. My team, family. Everything family. And when these 4 residents go, the chief, nurse practitioner, the senior most surgeon, we take them out for a dinner. And I pay for the dinner. They don't pay for the dinner. And when I say I get a salary of $500,000 plus. So what does it matter? But these people are my people for life. And these people will never call me by my first name. Like this lady once called me, her name is, I call them, we don't call them by their first name either. I said, Dr. Lyle. So she called me from Cleveland Clinic where she's assistant professor. So I jokingly said, I said, Dr. Lyle, you must be in a corner office with your shoes on the top of the, your desk in front when you're talking to me. She says, sir, I can put it on a video. I'm standing while I'm talking to you. A white lady telling a brown man. I rest my case here. Of course, I have my own family. And whenever anyone, faculty or resident leaves, everyone puts something like that and put everything around that. And that lies with me. And these are the things written from the hand and from the heart. And that is something I've seen. In America, I don't call even a medical student by their first name. We all call them doctor in front of that. I never say Kara Lyle. I say Dr. Lyle, Dr. Palmer. I get called Dr. Singh. So we have a respect for the things. If I have to give them dressing down, that will be in the evening. And this is a story I need to tell. You all know Dr. Michael Harrison, father of fetal surgery, 87. I met him 4 months ago in San Francisco. We were sitting in the park talking for half an hour. He doesn't know me. I know him. Of course, everyone knows him. At the end of half an hour, we were leaving. I touched his feet. He said, what is this? I said, Dr. Harrison, I'm from India. In Eastern culture, where you respect a person, you touch their feet. Then he told me, he says, but I worked Dr. Singh in 40 years in California. Nobody has done it. I've got a lot of people from India, Pakistan, Bangladesh, Afghanistan, and that region. I said, sir, with due respect, they're all coconuts. Then he says, what is coconut? I said, coconut means they're brown from outside, they behave like white. He says, that's interesting. As soon as I finish all that, he touched my feet. I said, what is that? He says, you only told me if you respect somebody, you touch their feet. I respect you, I touch your feet. I tell you, I am 35 years down the line in 5 continents and 3 of them English-speaking white. No white man has ever done that to me. Then I again had to tell him, I said, Dr. Harrison, there is another clause of 5 years, 10 to 15 years age difference. He said, yeah, that's fine. We again talked for half an hour. When I was leaving final, I again touched his feet. I thought this time he won't do it. He again touched my feet. And I looked at him with a smiling way. I said, Dr. Harrison, didn't we talk? He says, you taught me an Indian way. I'm teaching you a Californian way, because we don't care about age when we respect people. So what I'm saying is, and this is what is my equation when I see that. And this is what my daughter taught me, because she went to Harvard. She says, we used to go for the dinner with all these CEOs, whom Harvard used to invite after every 3 months and take, 25 MBA students. And we used to bet that we will not Google this person. We will go for a dinner and then we will tell, what do we think? Is he millionaire and billionaire? And then we'll Google it and check it. And she said, we were always right. So basically, this person is a billionaire personality. He's not a millionaire personality. Millionaire is Rolex watch. I took the company. I took it there. Everything is I. Billionaire, they are beyond money. And these people are learning people. They're not learner people. Even when we were sitting for 1 hour, he was learning from me and I was learning from him. He didn't say, I've got nothing to teach him. He said, look, you worked in 5 continents. You must have got a lot of things to tell me, which I as an American don't know, because my exposure is America. Your exposure is 5 continents. This is very important. You all know about Johari's window. I'll leave my slides. You can read it. Basically, it's about blind spot when you're driving. But how do you cover the blind spot of a person? In other words, the facts about you, which others know, but you don't know. That is called blind spot. How do you cover feedback? And that is something very Western. You always start the feedback with a positive. We call it warm up. Hey, how are you, Dr. Kara? You're looking very smart. Today you did a great operation. And then I'll come to what I actually want to tell her, that you were rude today. Your behavior is not good. You're perceived as arrogant and whatever. And then before she leaves, I will soften the real feedback. So that's called sandwich. The only problem is, this is very important. And this is where the Britisher get it wrong and American don't get it wrong. In Britain, the meat here is very little. You can hardly see it. So there's not even a feedback basically. And I tell them, I said, you people are pretending to be polite, but in that process, you become dishonest. Australians do better, but these people will tell you everything which you need to know. They say, we'll tell you what you ought to know, not what you want to know. Because this portion of the sandwich is very big in America. This is very small. In England, you can hardly see what is there inside. And when you come to whom to develop and promote, this is Dr. Arif Safari, very mild man. He is the chairman of medicine in West Virginia with 150 faculties. So I asked him, I said, how did you get hired? He says, I told him, I don't know how to do such a big job. He said, we'll appoint this man to mentor you. When I asked this man, I said, do you mentor him? He says, no, that was just to, take his walking sticks off. He swims on his own. And then what does he do? He picks the best people under him. An Indian, an Vietnamese. I won't put all the pictures. Because this is pure meritocracy. This man is commanding 150 white consultants.
Yes, sir. So thank you so much.
People ask me what to say.
So sorry for interruption. We are short of time. Can we take questions? Because our meeting will end in 10 minutes.
Yeah. Okay. I'll just wrap in 2 minutes. This is the difference between UK and USA. Do right thing, do things rightly, do the right thing. Bureaucracy, entrepreneurship. And this picture tells you. Obama. So that's the difference. And I'll just wrap up one more.
An attempted handshake is snubbed. Mr. Trump's poll ratings are improved. God bless you and God bless America. Thank you very much. In an extraordinary act of defiance, Nancy Pelosi made clear what she thought of the speech.
I stop here, ma'am. Thank you.
Thank you so much, sir. We have a lot of questions in a chat box, starting with the question which is here. One of the students have asked, what is the basic difference in training in UK and in US?
I told you in UK, the trainees, in UK, the trainees are service provider. We
Oh.
do not train them. We use them. And in that service provision, if they are lucky, they'll learn. But they don't learn anything. I'm telling you. In United States, the trainees are not service providers. I have other people to do the service provision. Either I have got other people to do the donkey work. But the trainee's job is only to go to the clinic, not to see the patients, but join me when I'm seeing the patient to get the teaching and off. They don't write any notes in US. They don't.
Okay.
So the ethos is totally different.
Okay. So the next question is, how can we build organizational culture? And how can we collaborate with different organizations in US and UK to provide electives for increasing exposure of our students?
Can I didn't get the first question. How
can we build organizational culture?
How can we bring organizational culture?
How can we build? How can we
Build.
build
That's a very good question. Culture, people tell me it takes ages to build, and I disagree with those people. There was a culture of a KK cult in a police in one of the states of the United States. So they wanted to get rid of that 50% of the policemen who are associated with the KK and all that rightist group. So they appointed a chief. And the governor asked him how much time it will take you to sort out the culture. He says, sir, give me a week, I'll sort it out. So what does he do? In 2 days, he picks up one policeman who attends this white supremacist rightist movements. He calls him into his office. He calls all the other 50 policemen and he says to him very politely, but very firmly, he says, I got proof against you. I have to suspend you and I have to inquire you. He says, fine. And he was about to go. He says, no, take off your cap and put it down. He put down. He again wanted to walk. He says, no, take down your belt and put it down. I want your badge. I want your gun. He thought everything is finished. He was about to lock. He says, no, take down your shirt and put it down here. The man went out of that office in front of 50 top brass in undershirt, no belt. And he says, if those shoes have emblem, I would have taken those shoes off also. And then, did he tell anyone, I don't want this type of behavior in the police? Nothing. All those 50 people were on tweet and Twitter and Facebook that, look, this is what happened today. The man went out of the undershirt. He took out his belt, cap, badge, everything. Then what did the culture did? Next day, change. He didn't write a single circular. What did he do? He took an action. So that is what I kept on telling you previously. The culture starts from the top. Because this police commissioner of the whole state wanted to do it not as a tick box exercise. He just wanted to do it. But if your top is wrong, you can bring Barack Obama, anything.
Yes.
Nothing will change. Top has to be pious. Now, coming to how do you collaborate? America is a capitalism of the highest order. People ask me, what is the antidote to racism, inequality, lack of diversity, lack of inclusion? And those of you who don't understand the difference between equality, diversity, and inclusion, I say equality is inviting you to my home for a dinner. Inclusion is inviting you for a dance in that dinner. So there's a difference.
Yes.
Now, America only knows one language, capitalism, bottom line. Bottom line doesn't come from this. Bottom line comes from billing. Billing comes from operating. And operating doesn't come from BS. And as I quoted the Lincoln's quote, you can't make fool of all the people all the times. So if you're a best resident, your chief is the best person, he picks up the phone, they will take you.
Okay. So the next question is, what are the attributes for selecting a good residence during interview with you?
I'll tell you, I will not interview in the formal setting, period. That's number one. Because I'm not interested in your behavior. When you walk with a suitcase into my office, no, I want you to take down your necktie. I'll take you for a coffee or a dinner or a lunch. I'll spend 2 hours with you. I'll talk about your dog, your wife, your partner, your boyfriend or girlfriend, whatever you are. I will dissect you in the informal setting for 3 hours. Then I will send you to my secretary. I'll say, Lena, can you take this man for a coffee? You are off guard. She will tell me everything. Then I'll send you with my sweeper. Basically, all I want to know is, because you can afford to be, you cannot afford to be not nice to me. I'm the chief. You'll be on your best behavior. But when I send you with a sweeper, he will figure it out. And that is where I'll test your personality. Basically, I will not hire you till I have tested your personality. Interview is a game. You are on your behavior. I'm not interested. I am interested in your inner personality. And I will dissect it out, not in a formal setting, but in an informal setting. And I can tell you, you cannot fool me. Because I will ask 10 people about you. And those 10 people, I'll ask the coffee shop person when he was in the queue for coffee, what do you think about him?
Exactly.
That's American Sikh speaking. In England, I can't do that. Equality, equal opportunities and all that. We call it BS. You can't.
Okay. So the next question is challenges. What are the challenges usually faced by candidates in MLE and PLA processes, and how can they address it?
Because none of you people, including Americans, know a fact. And I'll say it very slowly. United States of America is the only country in the world where you, as a foreign medical graduate, take an exam called USMLE, and every American medical student has to take the same exam. Same.
Okay.
But we don't ask PLAB for the locals to take. We discriminate you. Australia will take the exam for you, but not for them. Canada will take exam for you, not for them. Europe will take. India will take. What does America do? Same exam. So if you people score 98 percentile, and I'm a program director, let's say in West Virginia or Washington, DC, and I got a 10 resume, do I care the white man got 80 and the Vietnamese got 98? Whom would I shortlist? Of course, 98. Then I'm going to interview. Then it's not me interview. 10 people are going to look at you at 30 minutes each in a single way, so that there's no group thing. And those 10 are going to score. And if somebody scores a candidate 2, another score 8, and as a TPD, I want that person who gave you 2 to justify, and I want that person to 8 to justify. And I want them to argue with each other in front of me, discuss in front of me, and come to a consensus. And if they don't, I will interview the candidate again myself and show them, look, you gave 2. Look, this is a 7 candidate. So in other words, America does not discriminate you because you're taking the same exam, the local candidates. And when we interview, there will be 30% like me who have risen from the rank. And when I look at the CVs, I have a diagram which I can't draw. I wish I was giving the physical lecture. I have a CV with a mountain. And let's say A is on the peak of the mountain and the B is lower than B. I will not automatically select A. I want to know where the A started and where the B started and how much distance A and B covered in the last 10 years. And if the B is lower, but he started from the ground, I'll select the B.
Okay.
Because,
so the last question, because our time is about to finish. So when the medical students should start preparing for MLE or PLAB during their 5 years medical school time, when they should start preparing it?
This is a very good question. I think you should do those exams while you are doing your MBBS. If I have to live this life again, when I have done my first professional and second professional, when I've studied the basics, I'll do the step 1. When I've done my final year MBBS and all the clinicals, I'll do the step 2. And then when I'm done the internship, I'll do the step 2 CS and step 3. Now, there is another caveat to that. If you want to go to America for residency and you want to live, you need the top marks. But if you want to be like me, who wants to fly directly as a faculty or do a fellowship, I just need pass marks. So that is because USMLE, you cannot sit again. You either pass or fail. But if you pass, you can't improve the score.
Yeah. Thank you so much, sir. It was really a treat to listen you. Your learning from your very vast, beautiful, emerging experience. Really, I'm privileged to host this webinar and have a time to listen you in detail. Thank you so much. It was really very nice experience to have time with you.
Yeah, God bless you. And please give my card to everyone. I'm here to help anyone and guide anyone because nobody guided me. So I'm doing what should have happened to me. But
Yes. Thank you so much, sir. Inshallah, I will circulate your details on the groups. And if anyone wants to contact you, they can definitely. Thank you, sir.
Khuda Hafiz.
Khuda
Khuda
Hafiz.
Hafiz to everyone.
Khuda Hafiz. बहुत शुक्रिया. Thank you, sir. Assalamu alaikum. Assalamu alaikum.
Walaikum salam.